Hi, my name is Evan Dunn. We're back with our fitness assessments. So today we're going to do the waist and hip circumference, the blood pressure, and the skin fold assessment measurements today. So first off, we're going to do the waist and hip circumference. So first off, we're going to find the narrowest part of his waist. And so I would say that the most narrow part is about here. So I'm going to find where the belly button is, landed here, and I'm gonna wrap this around his waist. And we're measuring in centimeters. So after it's overlapped, I get 91.9 centimeters for his waist. And so now we're doing his hips, so we're going to find the widest part of his hips. And so then I would say that it's about here. So I'm going to place my tape measure here. And I'm going to wrap this around. Oh gosh. Wrap here. Thank you. Wrap this around. And this one, we have about 108.1 centimeters for that one. 108.1 centimeters. After I get my measurements, I will calculate the waist measurement by the hip measurement and get my total from there. So that is my waist and hip circumference. All right, so now we're going to be doing the blood pressure test assessment. So first you want to make sure that your patient is either sitting down or laying down and his arm is at the heart level. So we're going to have his arm just laid out, come over this way. His arm laid out this way. If you could scoot in a little bit, just so that you're a little bit more parallel. So first we're going to find the brachial artery. Typically the brachial artery is within the inner elbow. So we're going to find that, we're going to locate it. So can you lay your up there? Yeah. Okay, so I found where his brachial artery is. So now we're going to place the blood pressure bag onto his arm. You want to make sure that the bag is halfway above the elbow. You don't want it too high or too low because you won't get a accurate reading. So, and you also want to make sure that it is not too tight around the arm. So once we have made sure that is it too tight? No. Once we make sure that it's not too tight, we are going to first press the pump. We're going to place our arm on the brachial artery and then press the pump to 30, up to 30 mercury, I believe. So we're going to do that now. Oh, let me close this. Okay, so once I found it, I'm gonna let that rest. give that about 30 seconds. After the 30 seconds up, we'll be back to actually do the assessment of the blood pressure. Okay, so now we're going to find the systolic pressure for this blood pressure test. So we're going to palpate the brachial artery again. Okay, so once I have found it, we're going to pump it to 30 milligrams of mercury until we do not feel it anymore. And then we're going to release that. And then we're going to give that a rest. Once, the reason for a rest is you don't want to blow the artery, so we're just going to rest that for a few seconds. And then we're going to place our stethoscope on, hearing how the brachial artery palpates. And so we're going to pump that past 100, so about 130, and count 2 millimeters of mercury each time, deflating some of the pump as we go. So we indicated that the brachial artery is here, so we're going to locate that. I'm going to use the back side of my stethoscope. It's typically easier to hear the beating of the brachial artery that way. So I'm going to locate it again. And make sure that your patient's hand is palm up so that you can get a better reading. So we're going to place that here. And so now we're going to inflate it to past to about 130. Okay, so we have now deflated the pump. So we got a systolic of, so overall we got, the blood pressure that we got was 120/70. Typically that is normal. So that is the end of our blood pressure test, and now we're going to go into our skin fold. All right, so now we're going to be doing the skin fold test. So there are 5 sections in this test. Well, assessment, it's the chest, the tricep, the abdomen, suprailiac, and the thigh. So first we're going to start with the chest. So you're going to measure from the crease of the elbow to where about the nipple is. So this is where it is. About the middle is here. So at here we're going to mark So now that we know where the midpoint is, we're going to mark that about here. And so in order to measure the skin fold, we have to pinch about 3 inches and lift, and then measure about so about here, it's about the middle. So I'll say 4.2. So for that, I'll put 4.2. And typically you would have to measure twice, and if you're too far off, then you have to figure out which is the more accurate measurement. So now that we've done the chest, we are going to go into the triceps. So now we're going to be doing the tricep skin fold. So where you're going to mark first is the acromion process, which is the bony part of the shoulder. So we're going to just mark there. And then we're going to have your client bend their arm and make sure that their hand is supinated. And we're going to mark where the radial process is, and we're going to mark there. And so we're going to find where the midpoint is. So you're going to find where you marked, which is about here. And so we're marking here to about here. So down here is about 15. Midpoint would be at 7.5. So we're gonna mark that here. And so again, just like we did with the chest, we're gonna pinch. He's a bit more muscular, so it's gonna be a little bit more difficult, but we're gonna pinch and lift if I can. So I'll say I'm going to go about here, and so it's about 2 millimeters of thickness. And so I'm going to drop that down to, and so we're going to come back with the suprailiac measurement skin fold. Okay, so now we're going to be doing the suprailiac skin fold measurement. By the way, I just want to preface that for the skin fold measurements, you would want to use the right side of your potential client's body. So for the suprailiac, we're going to find where the crease of the elbow is and go about here. So now that we have indicated where the midpoint is, above the hip bone, we're going to have him move his arm the opposite way so that the arm is out of the way so that we can get an accurate measurement of the skin fold. And I'm going to lift this part of his tank top. We indicated that it's right, that the midpoint of the suprailiac is here. So we're going to get a thicker pinch here, a thicker pinch, and that is about 26 millimeters of thickness. So for our suprailiac measurement, we got 26 millimeters of thickness. I will write that down, and when we come back, we will be doing the abdomen skin fold thickness. So now we're going to be doing the skin fold abdomen thickness. So you're going to locate where, so we're gonna lift this up again. We're gonna locate where the belly button, the navel is. We're gonna stretch out our thumb as far as we can go. Pinch. And then about here is about 41 millimeters of thickness. So we got 41 millimeters of thickness for the abdomen. We are going to come back with our final skin fold measurement for the thigh. So lastly, we're going to be doing the thigh skin fold measurement of thickness. So you're going to want to make sure that your client is sitting down. His knee is at a right angle. You're going to try and find the midway. We're going to go the anterior side of the thigh, and going toward the midpoint of the patella. Typically the patella is about here, to the crease of the inner thigh. So we're going to measure with our measuring tape the midpoint of the crease of the thigh and the patella. So about here, we're at 20. So the midpoint would be at 10. So we're gonna mark where 10 is. And so we're going to pinch. If it is a little bit more difficult to get a pinch of the skin fold, it's easier to have the leg extended. So we're going to extend the leg and pinch. Hold on, let me do it this way. Sorry. Hold on. Can you hold your leg up? Straight out. Yes. Perfect. And so for this one, we have 32. So for this one, we got 32 millimeters of thin fold skin fold thickness. That concludes our measurements for today. Today we did the waist and hip circumference, blood pressure, and the Jackson Pollock skin fold. If you have any questions, please let me know, but have a great rest of your night.